Hi, my name is Sandip Prasad. I'm a urologic oncology fellow at the University of Chicago. And our group at the University of Chicago wanted to examine medication use before and after the treatment of prostate cancer. We think about the trifecta of prostate cancer care as being cancer control, urinary incontinence, and sexual function. But one of the components of urinary control is whether patients are actually taking medications to help with these symptoms. And actually the timing and utilization of pharmacotherapy for lower urinary tract symptoms is not really well understood, and it's probably an important component of quality of life for those men. So our objective was to look at the three major groups of medications: overactive bladder medications, 5-alpha reductase inhibitors, and alpha blockers that we use for lower urinary tract symptoms, and then see, based on the therapy that you got, whether it's radical prostatectomy, radiation therapy, androgen deprivation alone, or watchful waiting active surveillance, how the use of those medications changed before and after treatment. We used Serum Medicare data to identify over 9,000 men who were diagnosed in 2007 and treated for the subsequent year. We looked at the medication use 6 months before and then 6 months after treatment. The medications we use are described in the poster, but basically the most common medications we see for the two. The table 1 basically just shows that the demographic data differs by treatment type, and that's not surprising. I think the most important takeaways we had were that in the overactive bladder category, here you see in light blue are those medications that were used pre-treatment, and in dark blue those that were used post-treatment. And what we found was striking that overactive bladder medication use increased 6-fold in the radical prostatectomy group and doubled in the radiation group. 5-ARI patients, interesting, you'd think that would go to 0 after radical prostatectomy, as those were all done, but in fact there was still a component of men who were using these medications after treatment. And for alpha blocker use, we found that almost 30% of men getting radiation therapy needed alpha blockers before therapy. So I think in summary, the important takeaway here is that these medications are an important part of the assessment of quality of life after prostate cancer treatment, and it's important to include these when we think about how men are doing after the therapy. Thanks.